we hope that everything is going to go as planned. Thank you very much for that. We're moving ahead. Myself and the NARD president, Dr. Sudara, will be taking the moderation of the event tonight. And we'll be asking several questions. And we'll hope for policy making responses that will be able to impact the Nigerian society and improve the healthcare sector in Nigeria.
Our professors had opportunities outside,
Thank you.
and they will leave.
believe. Now, I think we are yet to even see the real impact of the effects. Down the line, over the years, we are going to see more devastating impact than actually what we are seeing now. Right now, we are seeing the result of the effect, of the immediate effect of those who are qualified and living. But as that effect rolls into less number of residents registering for specialization, down the line, we're going to have dwindling number of specialists from whom to recruit. We're going to have medical students graduating and immediately wanting to leave this country. So even the critical mass of young doctors within the country who will enroll either as medical officers to carry on with their career or as residents to specialize is going to dwindle. Now, yes, the stopgap measures, which to me, these really just represent temporary measures, which include increasing the retirement age, which include improving the retention of those who are graduating. But we know these are not fully implemented. We know in reality, these are policy matters, and in the typical Nigerian setting, there is a very wide watershed in policy and actual implementation. So unless we get it right, and how can we get it right? The first speaker actually analyzed it in a very succinct way. Chronic underfunding. Chronic underfunding is going to be in fact, it's the greatest challenge we face. That's everything you're talking about, from recruitment and creating the enabling environment, equipping to the welfare of those who deliver this quality care. It's all centered at funding. Now, the funding challenge in this country, I know, transcends just beyond the health sector. It has to do with security, but most importantly, to me, it has to do with how we even utilize the funding we have. Now, until I think up to now, the greatest amount of funding that goes into health goes into recurrent. That is just maintaining salaries. Capital, equipment maintenance, expansion, training, and so on and so forth take a very minimal amount of this amount of funding. So, yes, and the impact will even be worse in the future. For the NMA, our role remains solid advocacy, calling the attention of government to this practical reality and ensuring that our key players in the health sector, not just health professionals, mainly and those who do our budgeting, funding, and releasing of budget. And in fact, very critical is the way we do our procurement. I'm sure our colleagues who are practicing in other parts of the world will tell us that big time health industry players deal directly with manufacturers. Equipment supply and equipment maintenance are usually directly with the manufacturers. These are usually on leases. They give you the equipment where agents are needed. They give you the reagents where whatever consumables are needed, they do it for you. They do the servicing. All you are doing is remitting. And unless we adopt those kind of policies, then our equipping mechanism always be hampered by interest that result in corruption, that result in inefficiency, and that will result in poor quality of care and poor satisfaction by those who are on the field. Unless we solve these problems, I feel this impact, we have not even seen the beginning of it yet. Thank you.
All right. We appreciate you for that contribution, sir.
Thank you very much, Mr. President. And the next question will be going to the former WMA president, the World Medical Association president, the person of Dr. Osaho Enabolele. We have seen that this mass exodus of doctors from research is not only peculiar to Nigeria. India has had their share. China has also had their share. But in countries that are facing this current crisis, with your global experience as former WMA president, what best practices have you seen in other nations that have successfully retained their health workforce, particularly the doctors, in the face of similar migration crisis? What is India doing to retain their best brains in their country, despite the massive exodus of Indians from their country? What can Nigeria learn from that, using your global experience to be able to tackle this Japa syndrome? Thank you, Dr. Sai.
Yeah, first, thank you for inviting me to this session. I hope you are hearing me loud and clear.
Yes, we
Yes,
can.
sir.
We can hear you,
All
sir.
right, thank you very much. Now, I had a little technical age, but I'm happy I'm back here. Now, the first thing is to understand, do a root cause analysis before you can start throwing money to anything. And so governments that have succeeded, even in those developed countries, have a clear appreciation of the magnitude, the nature, the pattern, and the magnitude of the problems that they have to tackle. And having done those analyses, they're able to, of course, find some purposive, progressive solutions to them. Therefore, the question you ask yourself is that, what are the challenges that you're facing in your country? Every government seeks to address those problems that are challenging for them so that they can make some, improve their fortunes, either at sectoral level or at the global or the national level. So for those countries that have made progress, they've recognized the need for professionals, for instance, to have appropriate incentives, competitive wages, good workplace conditions. You go outside the country, you say your practice environment is like you having a living room. You go back to some of the developing countries, including Nigeria. Some places in Nigeria, you find consultation rooms looking like, oh, you wonder, is this really a consultation room? So they've invested in the security of their health workforce in terms of their wages, in terms of their workplace conditions, in terms of even social amenities, access to opportunities, social opportunities. I mean, the first speaker I heard talked about for professionals to engage in
portraying that question to Dr. Sion Nabulele, and we can also see that he is vast and is able to share with us the knowledge that he has concerning some of the policies and paperwork that he has done for several countries, and he brought to light what has been happening in some of these countries. But we are not going to be gender biased as we go forward. Let me ask Dr. Elizabeth Fajemirokun this next set of questions. You being a clinical supervisor and you've appraised what is happening within the health workforce, especially in a country that has standard. As someone who is living in a functional health system, what single reform would you recommend?
And that should not be